Welcome, everyone. Happy New Year. So good to see everybody. Be nice to see everybody in person, though, fairly soon. That'd be really cool. I'll turn it over to Glenn. Glenn, you're muted. There you go.
All right, is that better? Yeah, it's weird when you're on the phone, it mutes you out. I don't know, it's kind of crazy. Teams doesn't do that, but this does. I always get confused by that. So, all right, good morning, everybody. Happy New Year. Hope you had a great holiday season. Whether it went by too fast or too slow, it depends on probably the day and people that you were with or trying to enjoy the holiday with. So it was nice just to kind of decompress from all of the stress of 2020. Although 2021 doesn't seem like it's got off to a great start. So I think we're 7 days in, and I saw a funny meme yesterday that said you could return back to 2020 because your 21 trial has ended. I'm not sure we want to go back to 2020, but the 7-day trial apparently is up today. So anyway, with that, do we have Sally or Sherry, do we have anybody new to the committee?
I think we probably have a few people that don't know each other. So do you want to do a quick round of introductions?
Yeah, why don't we do that? So for those of you, I'm Glenn Kasperzik. I'm one of the co-chairs here with Sherry Friend on this committee. I'm with AMR Global Medical Response. I'm the group president for the Southwest region. And just to kind of, for the new folks, 2020 started off really good for us, and then we had to go to the Zoom world, but we really made a lot of progress with Dementia Friendly and some other small projects that the group did. So proud of what we accomplished in 20, looking forward to 21. We'll talk about that, and I'll turn it over to Sherry and then back to Sally, and then Sally can kind of go around the horn with everybody.
Sherry, are you there? Okay.
I think she's also on mute too.
Yeah, she's driving. So let's go around the room.
Oh, okay.
Oh, Sherry, there you are.
I'm here. Sorry. Sherry Friend with Oakwood Creative Care. I would agree we did some great things, even though we went virtual, and I'm excited for 2021.
Okay, let's do a quick round of introductions. How about a name and where you're from, who you represent? And we will start with Karen.
Good morning, Karen Stegenja. I'm a volunteer with Oakwood Creative Care.
Great. Next, there you are. You unmuted. I'm not sure what your first name is. Vanessa?
My name is Veda. Most people remember it by thinking about Darth Vader. I came out before the movie did. At first grade, you got that one kid in class that figures it out, and then you're branded for life. I'm with a nurse with the Mesa Fire and Medical Department. I'm over in the EMS division where we do our training and education for the crews. And I'm part of the dementia. Well, I joined the Dementia Friendly team, and we're trying to work. Hopefully I'll be able to catch up with Jean at some point, and we'll figure out how to roll this out between the crews and the community. So
awesome.
That's me.
Thanks.
And I whether this is the appropriate place to share it or not, I don't know. We were watching our church service last Sunday, and our minister said, I don't think 2020 is going to be much better. He said, or 2021, he said, I think 2021 is going to look at 2020 and say, hold my beer and watch this. And then we had yesterday happen, and it's like, wow, that was frighteningly accurate.
Hold my beer. Yeah.
Hold my beer and watch this. And we all know if you do first responding or nursing or any kind of care like that, it's like, that's not going to end well.
Yeah.
Thank you. Pam?
Yeah, Pam Williams. I'm volunteering for Fellowship Square. I see Todd's here, and he's a very good person to be on this committee.
Awesome. Thank you. Jean?
I'm Jean DeStores with Mesa Fire and Medical Department. I am in the Social Service Division.
Awesome. Cindy?
Cindy Rosenberg. I'm the Chief Nursing Officer for all the Arizona General Hospitals now, but the ones in Mesa are the Mesa Hospital itself and the East Mesa Emergency Department on Power McKillop.
Great. Congratulations on the change. Tracy.
Yeah, I don't know about that, but thank you.
Hello, I'm Tracy Beagley. I'm the owner of Sunland Home Care.
Awesome. Thank you. Becky.
I'm Becky Friend. I'm with Akoya Mesa Senior Living, and I'm just going to put out there that we're set for vaccinations on the 18th.
Good. Good. Todd?
I'm Todd Carling. I do the business development here at Fellowship Square Mesa.
Great. Tom?
Hi, good morning. It's been a while since I've seen some of you. Tom Intrieri, commander of Mesa PD, currently assigned as a training and wellness division commander. So responsible for the basic and ongoing education of all our personnel. And, I hope to tie in some of the education and awareness, especially for our brand new recruits on some of the signs and indicators and compassion I expect to see them demonstrate when they're dealing with members of the aging community. Let's just leave it at that. So.
Thanks, Tom. Kristen.
Hi, everyone. I'm Kristen Harvey. I do community relations at Jewish Family and Children's Services East Valley Healthcare Center. I've sat in on a few of these meetings so far, but I'm also relatively new, so it's nice to meet everyone, and thank you for letting me be here.
Thank you for being here. Laura.
Hi, I'm Laura Rice. I work for Aurora Behavioral Health. I'm a community liaison. We're new to the chamber, and this is my first meeting, so it's good to be here with you all.
Welcome.
Thank you.
Stephanie.
Hi, I'm Stephanie Espinoza with the Nutrition Professionals. I'm a registered dietitian nutritionist. I'm also their business development manager. We are a group of private practice dietitians that work with patients on overcoming chronic conditions and improving their health through changing their diet and improving their nutrition.
Great. Welcome to the group. Todd.
Good morning, everyone. Todd Harmiel, Regional Director with AMR Global Medical Response here in the Maricopa County area.
Thank you. I'm not sure who's on the phone.
Hi, Sally. It's Lori Marsh from the Summit at Sunland Springs.
Great.
Assisted Living and Memory Care. I'm driving today, so it's a phone in.
No problem. Thanks for being here. Okay. Glenn, you want to just go right into a report from Michelle?
Yeah, let's do that. And then Sally, I don't know if Senator Kelly's office yet has anybody that we could reach out to, or maybe I saw Michelle shaking her head, maybe a little bit there. Maybe we can get that connected as well. But we'll turn it over to Michelle Caldwell from Senator Sinema's office. I'm sure there's no report for the month or anything, so it should be brief, right, Michelle?
Yes. Hi, I'm Michelle with Senator Sinema's office. We are currently working with Senator Kelly's staff. They are not quite up and running yet. It can take a very, very long time during normal times to get an office up and running with computers and phones and all of that stuff. So working remotely just complicates that even more. So I will make sure that the appropriate people from that office are clued into this committee and will be included on that. As far as updates from Congress, new members were sworn in on Sunday. Obviously, everybody saw the disaster that was yesterday. We're thankful that our staff who was with the senator and the senator are all safe during that terrible time. They were able to go back and finish the business of the people and certify the election. So that was a positive out of that. There will be no new legislation introduced now in the chambers, like policy legislation. Who knows what'll come activism-wise until the inauguration. So they're holding back legislation until the 20th. Luckily, we were able to get the latest coronavirus package passed before the new year. So that's the extra $300 a week for unemployment for an additional 11 weeks on top of the CARES Act. So in Arizona, that brings it to a total of 50 weeks of eligibility for benefits for those who are unemployed. It extended the PPP program as well, and I believe there might have been some new rules that were released very early this morning for that, and new guidelines for that. So if any of your businesses or Sally, anybody in the chamber has questions, you guys can always come to us and we'll try to figure it out. Other than that, we don't really know what's going to happen. We don't even have a calendar yet because the Senate races in the runoff still have to be certified through their election. So we don't have leadership roles determined yet. We don't know what committees will be on. There's no Senate calendar yet. So we're a little up in the air right now, but hopefully by the next meeting, I'll have more information for you guys.
Great, thanks, Michelle. Again, appreciate all the work the senator's doing, and look forward to 21, and hopefully we'll get some new legislation around the COVID pass or some other parts and pieces that have maybe not have been inserted in previous bills. So I know this group here is really in touch, obviously, with healthcare. So we'll keep you informed on any asks or any challenges that this group is having, or just healthcare in general. So as 21 gets rolling with the Congress, we'll hopefully see some progress with that. So Sally, I don't know if anyone has any questions or any immediate concerns that we can address with Michelle. We'll open it up to the group momentarily there.
Michelle did put her contact information in the chat for any of you who want to reach out to her. I know there's some new folks on here, so you might make a note of that.
All right, great. Thanks again, Michelle. We always appreciate you being here with your updates. All right, what we kind of wanted to do here, and maybe this somewhat can be a little bit of a listening post as well here for Michelle, is maybe just go around. We have a pretty diverse cross-section of representatives from the healthcare community here in Mesa. Maybe just a brief COVID update, if there's challenges or things that your organization sees or needs that may be helpful. We can start to track some of that, or just kind of the status. We see vaccines are rolling out. We're moving into phase 1B here in Arizona, which is good. So hopefully that'll continue. I do know people are getting their vaccines. I've heard great things about the process for those who have gone through the drive-throughs, at least for those immediate healthcare providers that have been eligible for 1A. So I think at least I can say Maricopa sounds really organized as it's come to that, and the several people I talked to had nothing but praise. So with that, Sally, I'll kind of let you control the board here, but we'll open it up to the group for any open COVID dialogue.
It's very quiet.
Well, I can tell you from the point of healthcare, as far as the hospital goes in Mesa, we are full. We're over 3/4 of our population in the hospital is COVID positive patients. We are holding in all of our EDs. We're smaller than the other Valley hospitals. We're only 50 beds at Mesa. And we were not obviously staffed to go to 50 because it was a slow ramp up as we had just opened in 2018. We have quickly had to make transitions to try and bring a ton of travelers in. We did get confirmation of some travelers from the state of Arizona. Unfortunately, a lot of them have canceled their contracts before they show up because they're getting paid more money in other states to respond there. But we are making do with what we have. I can say for the vaccines, I mean, I've had my first dose as well, and the pod in the Southeast Valley that Dignity is participating in has run very well, as Glenn stated. I will say that registering and trying to deal with the county's registration system has been a nightmare for the majority of our team and most people that I know. As a matter of fact, Dignity Health finally just opened up the pod to have nurses come in and get vaccinated because you can't get to the county. Like when I got my notification from the county to register, they were trying to send me to Winslow or Tucson to get my vaccine. And then when they said they fixed it, then they were sending me to Show Low and to Snowflake to get it. So Dignity Health just opened the pod for everybody that had the registration to go get it at the Southeast pod where we are, running that at Chandler Gilbert. We are opening up to 1B, and I hope that goes smoother. But I can tell you, for those of us that had the first dose, we have not received notification yet for the second dose, which should actually be happening next week. So they are still continuing to have some issues with their registration process.
All right, thanks, Cindy. Anything else from the group that we'd like to
Tom,
talk
can
about?
you give an update, maybe PD and fire can give updates on how you're all getting through the process of getting your vaccines?
Yeah, I know fire's kind of leading the charge. We're getting information through our Homeland group that the vaccines are coming. I was told in February. Out here at the academy grounds, I know a few of the fire personnel have already gotten their first shots. I don't know, to be honest with you, the exact process and how long it's going to take, but I was told it'd probably be come February, we'll definitely be up and moving forward pretty quickly. So as far as COVID itself, we obviously have had several cases. Glad to say that the overwhelming majority of them have been mild. Everybody has symptoms, but for the most part, we haven't had any members of our agency fall seriously ill. So that's been a good thing. And I think a lot of the protocols and precautions that we put in place have also mitigated the spread, because we started that probably beginning of April, the cleaning of all the rooms, the sanitization processes, and we've maintained that. And with that being said, in 2020, it was the first time the Mesa Academies ever completed 3 police academies, 3 classes. And for those of you aren't aware, we actually host, we're a regional academy, so we serve all the East Valley agencies. So we were fortunate that we were able to continue that process and get these people through our training safely, with 0 cases within the academy structure. So it was nice. But yeah, we're looking forward to seeing how we can incorporate the vaccination process as we move forward next month or two, along with that process. So.
Becky, I saw your hand go up.
I just thought, I would be willing to speak out for assisted living, memory care. We have always been proactive, so we've been doing weekly testing during the holidays, knowing people are going to be, tempted to get out there. And I just want to say again, transparency, that we have had 3 staff members that we picked up through the weekly testing. So of course they immediately were not on site. And so far that has protected all of our residents. I know, things can change, in the blink of an eye, but testing is just so important in situations like this. And speaking out on behalf of the fire department, EMS, AMR, I would like to see them all be able to get their vaccinations quickly, because when we need to ask them to come into our community, I know that presents risks for them as well. And I think if we're all working together and all getting protected, they will feel much better coming in too. So just my shout out to, all of those of you helping us as well. And we are, like I said, 18th residents and staff members, vaccinations. I'd be thrilled if it was sooner, but that's the date they gave us. So trying to do our part.
Thanks, Becky. Anybody from PD have any comments?
I can speak somewhat from the fireside. So I know that, and then Jean, you can speak up too, please, back up, give any additional, because I've been working, our entire office got banished and worked from home full time, because out of the 8 or 9 of us that are in the office, 6 of us wound up positive for COVID and symptomatic. And so we're all at home mostly. I know that we are working on getting the vaccines in. There is a very, very strong push to make sure that all of our providers are getting the vaccination. Where we've got, I think on any given day, we have a couple of trucks that are not running at full speed or that are down, because we've got, just like it's going through the community, our crews are getting it and they're sick as well and they're home on quarantine. So we've tried very hard to make sure that our crews are getting vaccinated. We do have within our immunization division as part of EMS, we do have a number of our crews that act as vaccinators or work in our immunization clinics when we have them. And they've been actively working at all of the pods, specifically the one down at Chandler Gilbert Community College. So we've been trying to be very involved in that, try and make sure we get our crews vaccinated. I just completed some training with the immunization with DHS for immunizations. I'm the backup coordinator for Michelle Denton, who's one of our captains, who is the primary immunization coordinator. And I think we're looking to, Jean, and correct me if I'm wrong, I think we're looking to start maybe receiving some of those vaccines so that we can, or order some of them so that maybe we can start going ahead and giving those out. So it's really, we're really trying to work with our crews to make sure that they're getting what they need. Because much like the care facilities, one person gets it in a station and then everybody gets it. So, and actually one of our office staff had been going in and out. She has a secondary position where she works doing things in people's homes like IV treatments, and she'd been doing fine. And she worked one shift at a station, and then she became positive for COVID and sick because it was just there. So I'm not sure if the plan is to, I'm pretty sure and certain, but I'm not sure that the plan is to go ahead and start getting vaccination so we can take care of the city employees and PD if they haven't been part of the 1A step. We just like you had said, we had some issues getting some people with the website sending them, hey, you can get your vaccination, but you need to go to Shillow. So we've been working with the county to try and get that solved. And the other challenge that we had is a lot of the appointment emails were going to people's junk emails, and so they were missing their ability to be able to make their appointments because they couldn't find the emails. So, but that's solved. And that's where we stand. We continue to reinforce with our crews, make sure you're wearing your proper PPE, make sure they're really good about making sure that the stations are cleaned on a regular basis. They're doing their best to follow the protocols that they need to follow in terms of going into people's homes or into care facilities to make sure that they're following those protocols. Yeah, that's where we're at with this. So, Jean, did you want to add anything?
No, actually, Veda, that was very accurate and up to date. So we'll just go with what you had to say there.
That's my challenge working from home. I stay in touch, but I'm not sure just how in touch I really am.
Michelle, you had a comment?
Yeah, I just wanted to touch on what Cindy had mentioned regarding the difficulties. Unfortunately, we've been hearing that from a lot of people in Maricopa County. So we did actually reach out to the health department yesterday. We're waiting to hear back, so I'll be sure to pass along to Sally so she can give to the group any updates we receive about that. What our thinking is they're waiting on sending out the notices for second doses until the state receives confirmation from the FDA on them being shipped. But we will keep you guys apprised of any information I get regarding that and how we can help the county and the FDA figure that out quicker.
That'd be great. Thank you, Michelle. We appreciate that. Tracy?
Nellie, if I could just say one more, oh, sorry.
Yeah, go ahead.
I was going to say one more thing, and I can probably say this on behalf of everybody that's coming into the hospitals, but for our staff for sure, and I'm sure Fire, PD, and AMR, and all of our partners in healthcare, one of the concerns that is weighing heavily on us right now is the post-care for our employees after we get control of this pandemic, because their emotional health right now is at stake. I know I have quite a few employees that are actually taking days not because they're sick physically, but they're mentally sick right now. So and for Michelle, for you and your team, as you guys are talking about ways and things that we can do, if you can just keep in mind things, maybe potential programs that we could have available for our teams as we progress through this pandemic and try to get on the other side of it to handle the emotional stress that they've all been under at this point in time. And just it's devastating to see some of the reactions and the things that are happening with our team. So I think that's for anybody that's involved in medical and healthcare at this point in time.
Thanks, Cindy.
Just a side note with that, I do know that the San Franciscan Renewal Center, however you say that, actually received a really large grant to do a kind of work through the emotional component of the pandemic. And so I can get information on it, but they'll be doing kind of PTSD
retreats, essentially, specifically for healthcare workers related to the pandemic. So Sally, I'll send you
is that the Franciscan Renewal Center?
Yeah.
They're great. They do a lot of work with veterans as well. So.
Yep, the same program with the veterans. They're going to transition that for healthcare workers.
Okay, Tracy.
Sure. Yeah, with Sunland Home Care, we provide caregivers to work in homes with seniors, and we have seen a huge influx of clients that want to stay home, or are we're thinking about moving into an assisted living and memory care and decided to stay home, or are being discharged from a hospital and are afraid to go to a skilled nursing facility. And so they're opting to stay home because they're just with our caregiver and, themselves at home, which I know our facilities are doing amazing work and working really hard, as we all are. But the crisis that we're seeing is that with a huge influx of people wanting to stay home and not move into facilities, there's just not enough caregivers, as many of you know, to staff this. And so we've had to turn away so many people that need assistance at home. And it's become such a huge burden on families, even more so, the families who are working or out of state and concerned about their parents that live here. And so home care has been a big challenge. And in addition, we've been providing a lot of support for staffing for, for assisted living and memory care that have had outbreaks and literally have had no staff in their buildings. And so it's just been a super taxing time on everybody, but definitely the caregivers, and trying to keep our clients safe at home, but yet support the facilities with the staffing that they're needing as COVID has kind of gone through some of these buildings.
Vicki?
Can I just weigh in again? And I'm going to guess Lori probably might want to also, that I do understand the concern. I've had people talk to me about that, but quite honestly, especially in memory care, our memory care people really are not aware anything's going on out there, because we're keeping their life protected, and activities and meals and, life goes on for them daily. And we all also are sometimes feeling a little maxed out because we are going that extra mile. But even on the assisted living side, like I said, with our weekly testing and our being very, very careful with our staff, they're not happy sometimes when we have to do short lockdowns just to keep anybody from getting sick. But like I keep telling them, your very nice apartment here is a lot nicer than a hospital bed on a respirator. So we're still keeping them with all kinds of activities and things going on, and excellent food. So while I know that a lot of people have that fear about coming in, really, they're at least as safe, I'm going to say safer in many, many cases, than if they're at home isolated, not getting socialization, having to worry about where their meals are coming from. So just try to encourage them. I know you're not going to win them over always on that, but encourage them. A lot of work is going into really keeping them more safe and more engaged with more socialization. So Lori, you want to weigh?
Yes, I do. I appreciate that. Yes, as on behalf of the summit at Summerlin Springs, between our assisted living and memory care, our staff, we are definitely seeing that our staff is just putting in the hours and putting in the time and the heart to take care of our residents in the best way possible, and then still going home to try to take care of their kids in school situations and their other loved ones. And we can't get the vaccines soon enough. I actually was the first one within my community to get it, maybe just because I signed the paperwork fast enough. And so my second dose is the 12th. So I'm looking forward to just being able to work through that process. And we don't have a date for our residents to get our vaccine. I heard February. So we are encouraging people that have been sitting on the fence with bringing their loved ones in to actually go ahead and take advantage of the fact that we are on a schedule, and we know that our residents are going to go ahead and get that vaccine. But it is just a waiting game right now while we keep our residents' spirits up as we continue just to wait our turn to be able to get the vaccine and then be able to open up for more activities, for more engagement, for more visitors. So thank you, everybody, for that support of our community fire, and especially as we ask those EMTs to come into our community and assist. We know that they don't know what they're getting when they walk in that door, but we certainly do appreciate it.
Thanks, Lori. I don't see anybody else with hands up. Glenn, do you want to move on to Sherry?
Yeah, thank you, everybody. I took some notes on just some of that discussion, and I will bring some of that back up as we maybe look at our 2021 goals or speakers. So with that, we'll turn it over to Sherry for Dementia Friends training events and general update on that.
Hi again, everybody. So, Karen, do you want to give an update on how the dementia training is going?
Sure. We didn't do any in December, but we trained, and I don't have the exact number, I apologize, somewhere between 30 and 40 people when we started in September. I think we had about 4 classes. So we'll resume that when it's appropriate sometime this year. Also, I during that training got a lot of questions from businesses about making employees dementia friends and doing that within the business organization. Right now, Dementia Friends America requires that the Dementia Friends trainings are either in person or virtual. So from a dementia champion. So we can't like do a video that businesses can just show to their employees and keep them up to date and so forth. However, there is kind of a side program that they have approved, as long as you don't use the Dementia Friends logo and title, I guess, where businesses can become dementia friendly. So Southington, Connecticut is one that I looked at that they had sent out, and then I contacted Meredith Hanley with Dementia Friends America to see what the difference was between the business program and the Dementia Friends program. And we're going to get on a call with her, Janice Greeno from Banner, and I, and whoever else wants to be on the call to discuss what we can do for businesses. But basically, it's kind of it's a training for businesses about how they can make their environment more dementia friendly as far as lighting and signage, colors and things of that nature that make it more friendly for those with dementia, customer service. So some of it incorporates the Dementia Friends training, but some of it, a majority of it is what can you do for the business environment. And then there is a form that they fill out that they've been through the training or they're interested in the training. And then there's actually a decal that they can put on their storefront that says, we partner with dementia friendly Mesa or something like that in our case. So there is some incentive, or I imagine they could put that on their brochures, dementia friendly partner, things of that nature. So we're just starting that information. If we feel that there's enough businesses in Mesa that want to go through that program, it is a video training. So that's what's good about it. Southington had set up a video that people can watch, and then they fill out a form, and then they get approved, and then they get the decal and so forth. So it's not a requirement for in-person. That's why I contacted Meredith, because I was confused that they had always required in person, but because this is just a little tweak of the program, they do it with a video, which we could probably talk to Southington or the powers that put the video together and just kind of either use that one or just use it as a basis for what we can do in Mesa. So something to talk about and consider. And Janice and I will probably get with Meredith next week on a phone call just to get more specifics about what we can do.
There is a website. Michelle, you had asked for information. I put the website in the chat of what they have so far that we could potentially, work off of. But I appreciate your work on that, Karen. And we're kind of opening a can of worms, which is exciting. We can kind of help lead the way in Arizona to make it more of a designation than just going through the training. So that's awesome. We did do a little mini dementia-friendly event in the spirit of Christmas and trying to get folks out of their home and experience a little joy. And we had a drive-through Christmas experience, and we had over 70 cars come through, so probably over 250 people altogether came through and got a free breakfast and a bag full of information about Dementia Friends and about the different things going on within Mesa. So I think it was a successful event. Anybody else who was there want to talk about that? And we did get news coverage for it as well. So that was awesome. Thanks to Sally's connections to get a little coverage about what we're doing with Dementia Friends. So that's really all that
we drove through. It was very sweet. We had a good time. It was nice to see Santa.
That Santa is actually my uncle-in-law.
Well, pretty good.
A real bearded card-carrying Santa, whatever that is. Anyway, little hidden Sherry fact: I'm related to Santa. But as far as Dementia Friends goes, that's really all that we have going on. I think we do need to kind of talk about 2021 and goals we want to achieve other than the business designation. If we want to launch a memory cafe, what that would look like, if we want to wait until we can do it in person, or if we want to launch into some kind of a virtual experience. So I just want to open it up for any thoughts real quick, if you have any urging things that you want us to start looking into.
I'd love to see our business community be able to have a designation that, the business is dementia friendly, not just, a one-off employee or, that kind of thing. I think that that's a nice marketing tool for businesses to be able to say that, especially like restaurants and, different business categories that actually deal with, an older population. So yeah, we're behind doing whatever it takes to get that out there and make it happen.
Sally?
Yes.
It's Lori from the summit. Can you speak to the survey that went out and any results of that?
Sherry can, maybe.
It's been a minute since I've looked at it. Karen, do you remember?
Maybe what the goal was. What was the goal of the survey? Not necessarily the results, necessarily the total results, but what the goal was.
You're on mute, Karen.
Is that the survey that we did originally for Dementia Friends, or the one that they just sent out that Meredith Hanley wanted to do as far as a whole nationwide survey? So I guess I'm not sure which survey you're addressing.
feel like it was a survey that went out about a week and a half ago.
Okay.
And it seemed like maybe it was specifically directed at Dementia Friends.
Right. That came from Meredith Hanley with Dementia Friends America, and they're trying to get a picture of what's important to people with dementia that needs to be in the Dementia Friends program, whether it's, and I don't have the survey in front of me, but as far as Memory Cafe, what is quality for people with dementia? So it was kind of difficult I took the survey, and you're kind of trying to answer for people that need the program or that have dementia. So it was kind of difficult. You kind of do it from your perspective, I guess. Maybe Sherry can weigh in on that a little better, but they're just trying to get a handle on what is important to the caregivers and the people with dementia as far as what they need from a dementia-friendly city. And so that was the purpose. I have not seen, I think they had until the 12th to fill it out, if my memory serves me correctly, as far as a date. And then we'll probably get results sent down from Dementia Friendly America from there. Did anybody else take the survey? Any comments on that?
I took it. I hear what you're saying about it. Was kind of hard to say from somebody with dementia from their perspective what was important to them. I didn't really feel qualified, but I did take it, and it's a start. It's a good start.
Yeah. So I imagine by the end of the month, we should see the results, and then I can certainly get those to Sally and she can send them out, hopefully prior to whatever our next meeting date in February.
Thank you for the update. Thank you for the update.
So we will then focus our energies on the business, and if there are any other ideas or ways that we can connect to the community, please feel free to email, and we can kind of plan for 2021 as we go.
Tom,
thanks, Sherry.
I will say too that as far as the Memory Cafe, the memory cafes that do exist in Arizona have all been virtual since last spring. So we do classes for the Sun Lakes Cafe every Monday at 1 o'clock. I think Tempe is still doing some support group and classes, and even Oakwood has classes that they have been doing virtually. So it's not an insurmountable task to try to get something started virtually until we can meet in person. But if in person is the goal for a Memory Cafe, then it's probably going to be close to the middle of the year or later in the year before we can actually do that. But virtual, even if we advertised, anybody is welcome to join the Sun Lakes link. You can just click on the link and then join the class, a variety of topics. And I don't know what Oakwood is offering now as far as their schedule. So get with Sherry or get on their website.
Sherry, anything else?
All right. All right. I think for 21, Sherry, it's probably best with the goals and everything around dementia. We kind of keep that as just a separate item on the agenda, so it's standing in that way, that track. So Sally, we'll note that for 21. That way we can always have a set of updates and a specific subset of goals around that outside of what the Aging and Healthcare Committee is going to do, because it's such a great project that the team has done. So excited about getting people back together at the Memory Cafe. I think virtual is well, but I think once we can get back in person, we'll have great value, and certainly, business recognition or certification around that, I agree, is, also an advantage for those businesses to draw business into their establishment. So great work. Continue that into 21. So the last two topics we kind of have on the agenda here is, because we've been in the virtual setting, we've had a series of guest speakers come on and kind of talk about various things during COVID are very specific topics. And I think since we're going to be in a virtual environment, at least for the foreseeable future, I think it would be a good idea, and maybe not every meeting, because we still have other work and goals that we're going to want to be able to get accomplished. But we established a speakers bureau, and we can coordinate that on the calendar for specific meetings and get people in to speak about topics relevant to aging healthcare or COVID or any other emerging topic that's going to pop up in 2021 that we haven't heard of yet. So I just like to open it up to the group, and certainly, I don't expect that, something will pop into everybody's mind, but if we could, if something does, email Sally, and that way we can get it kind of on a list of people, and there may be speakers that may even cross over to some of the other committees as well that could be beneficial. So we'll spend a few minutes from the group if anyone has any great ideas for some presenters. And typically, I think we've held it around 30-ish plus minutes, 30 to 40 minutes, and then have an opportunity for questions. So the time commitment isn't all that terrible. It's not like they have to have a whole hour of material. It can be, 15, 20 minutes with 15, 20 minutes of questions, depending on the material that they're presenting.
Then to follow up on some of the stuff that Cindy was talking about earlier, and then obviously, we've kind of all been tracking the teen suicide stuff. Maybe having somebody talk about mental health might be smart at this point. I know Katie McPherson was on a few months ago talking about the teen, side of things, but I know our senior suicide has been probably as high as it's ever been. The teen suicide continues. I mean, we're hearing it every week. So obviously that's still an issue. Just sidebar on the teen stuff, we are working on several things. We're working on an app for teens. It will obviously expand from that after it's launched, but Mesa Community College has a program that we're working on out of the chamber called the App Boutique. And so they're building apps. So I basically approached them and said, we need something for our community. So they're building an app for us, which is awesome. We've also got some authors that are coming together to work on a book and a journaling opportunity for young kids, because we know that the youngest that we've heard of is 8 years old. That was a while back, and then we had a couple of 9-year-olds. So we need to start really focusing on our younger students. And then I'm working with Mesa Public Schools on a writing contest that will be launched February 1st through Republic Media. And it's just kind of an opportunity for students and teachers to share feelings about what they've learned through a pandemic, resiliency through a pandemic. So we're trying to keep it positive, but can't have in-person meetings with these students. So we're looking at, other options. And I just know that, mental health is probably one of the things that PD and fire deal with more than anything. So following up on Cindy's comments about the healthcare workers, I don't think we all think about how it affects people mentally. I know everybody's tired, but it's got to be taking its toll.
Yeah, no, those struggles are real, and I appreciate the dialogue we've had around that, and I think forward looking too is the impact is just the attractiveness of the healthcare industry, right? Are people going to want to get into healthcare to be nurses or paramedics or care providers in any sense? And just discussions I've had with either peers or other folks in the healthcare community, I mean, that struggle is real, and there's a lot of growing concern around that related to it. So I think that's going to be a relevant topic that we're going to have to address, and certainly something maybe getting, a couple presenters in throughout the year to talk about that. And even maybe one of the goals here short term is have this group put together through all the connectivity, some type of community resource list that we could get out to all of the partners here on this call and have those resources available for people who are struggling. A lot of this is very private. It's not very forward facing. Those who are forward facing, we can intervene in that, but unfortunately, a lot of this happens privately, and it's this coupled with the financial struggles, coupled with the homeschooling. There's a myriad of factors that are weighing in on people's just health and wellness, and even diet and nutrition would probably be a great topic around that, right? You are what you eat at times, and if people are stressed and they're just doing the wrong things, it's impacting them. So there's a lot of little things I think this group can do collectively because of the expertise that sits here once a month. So, those are some of the goals I think we can look at and quickly get established and ideas around that for 21.
Can I comment, Glenn, since you brought up nutrition? I've been thinking a lot about that because you're right. Nutrition's the foundation of our immunity and our health in general. But what we're seeing, and I'm gonna speak to the Mesa Fire and police that are on the line too, and that is eating can become a coping skill. And when people are suffering from anxiety or PTSD, depression, that disordered eating becomes a big problem like alcohol or drugs may in someone's life. And it really can disrupt their life. It can disrupt their thinking, and it can disrupt their health if they're diabetic or have heart disease or things like that. We really are an underutilized service, and dietitian services are typically covered on people's insurance. And so I appreciate you making that shout out, because I think there's a lot more that we as dietitians can do that we're not able to do because people don't understand how we can actually help in an emergent situation like this.
Yeah, no, thank you. I appreciate that as well. And just, I don't want to cut the time short. I know we're coming up on 9 o'clock, and Sally, I do have to drop at 8:55 in prep for a 9 o'clock call, but I'll turn it over to you and Sherry at this point to kind of solicit for additional ideas for goals and for speakers. And then we can maybe re-huddle between the three of us post this meeting and kind of get it set up for the February meeting, so we can really hit the ground running with some core content for this group. So I'm gonna kind of disappear from the screen, but I'll turn it over to Sherry and Sally, and then I'll circle back. Thank you everybody for your participation from my view, and look forward to seeing you next month.
Happy New Year. Anyone have any other suggestions on speakers? I loved hearing from the ER doc last month. I don't know about you guys, but I thought that was really interesting. Just hearing kind of firsthand from somebody who's really front lines and just exhausted and dealing, with patients coming in.
He really foretold of this fiasco of the vaccines not being distributed. I mean, he said his company really didn't have a plan, and he couldn't verbalize that. And I thought to myself, ooh, that's not good, right? And lo and behold, here we are. So I hope they're getting that organized more so, because this is getting a little out of hand. I appreciated his comments.
I just wanted to add, at any time that you need a presenter or a speaker on behalf of mental health, us at Aurora, we can do that for you. We have a lot of, excuse me, I have COVID right now, so it's hard to talk. Yeah, but any of our clinicians, sometimes our psychiatrists, we are in the front lines also. So it wouldn't be me speaking today, obviously, but yeah, we have a lot of topics that we could share. You just let us know what population you want us to focus on, but it's hitting everybody as you're talking. So just let us know. We'd be happy to.
Anyone else? Sherry, any final comments from you?
No.
Okay, well, we can end the call here. It's fine. We don't have to keep going just to be going. Yeah, if you think about something, just shoot me an email, and we'll try and get some things lined up. But I do think that if you can all be thinking about not just your own organizations or businesses, but others that you think should be trained for the dementia friendly designation. I think it's important. You know, I'd love to see, you know, everybody's websites have that little logo and stickers, you know, decals on the doors. Nothing better than walking in and knowing that the staff inside is prepared to, you know, welcome and acknowledge and understand an elderly person that walks in. I have a cousin who I'm trying to help every day, and it's been a challenge. And you know, I feel bad because when she's out on her own, I don't know that everybody else understands that she has a condition that, you know, just requires a little bit of care. So,
Hey,
okay,
Sally, if I could make a note.
Yes.
Yes, Lori?
Yes.
Okay. I just wanted to add that I did do a training for 10 of the students over at Desert Vista High School in the Red Cross Club on dementia friendly. And so it was great to see some teens, some youth be interested in the topic and looking to be able to get engaged. I really hope that there's a way that we can get some action for some of these people that have gotten the training to kind of understand what they can do next steps. And so I look forward to participating in any conversations that can help really drive next steps for the dementia-friendly program.
Great. Thank you. Todd, I think you had something.
Yeah. This is just an idea, and I would be very open to even having ideas or feedback from anybody else. Seniors, one of the big things seniors need is something to do or purpose. I know we talked about all the preventatives, all the stuff of what happens with suicide and other things that as a result of isolation, but is there projects or something? I know when people are depressed, if they give service, that depression goes away. And because they have a purpose, they have a project. I know with isolation, with seniors, because with our community, sometimes we're getting a big lockdown, others depending on where it's at. But if there's like projects that we can, like a kit of a project that somebody can do and then return, we don't have to gather in groups, but it's something that we can give or have an opportunity for seniors to do. And I'm looking for any kind of projects that maybe we can put together or help out somewhere else. And I know, Sherry, this is probably up your alley here.
Yeah, we can talk more about that.
Okay. Yeah, give me a call.
Okay.
Karen, did you have something you wanted to add?
Well, I was just going to say, Sally had mentioned the working with the younger generation, and then Lori just mentioned it too. When I was doing work on elder abuse prevention years ago, we did a contest through the Attorney General's office, an art contest on what does elder abuse look like to you, and it was high school students that contributed their artwork, and then they judged them and they got a little bit of a prize. So if we want to get intergenerational, maybe we can either poems or, you know, what does dementia look like, or what does it feel like? Some of these kids might even be dealing with grandparents or parents that have dementia. It's a good way to connect with the younger generation, just like Lori was saying, even going further, whether it's junior high or, you know, any of the classes that are capable of understanding and giving us their impression of what dementia means to them or what it looks like to them. So just an idea.
I think that's a great idea. Anything else? Okay. Then you all have, I think, the rest of the year on your calendar. So we will see you in a month. And in the meantime, again, if you have any, you know, suggestions, I see Tracy's already emailed me. Thank you. If you have suggestions for speakers, great. Think about wanting, you know, Karen would be happy to sit on a call and train 20 of your employees. Yeah, we've had a handful of people, but we really do need, we need the masses now. I think it's time. All right. Happy New Year, everyone. Thank you all for all the work that you're doing for this, not just committee, but this population in our community.